Our next speaker is Mr. Kaushik Ganguly. So could we please introduce Mr. Kaushik Ganguly?
Kaushik Ganguly is an expert in public finance, health and nutrition financing, climate change, and research capacity building in developing and less developed countries. In his more than 15 years of experience, Kaushik has led economic research in the area of assessing health systems, health financing, fiscal federalism, public expenditure, accountability, and managed cross-country collaborative research projects in more than 40 countries around the world. Now let's welcome Mr. Kaushik Ganguly to deliver his address.
Thank you, Shreya, for the introduction, and thank you, colleagues from EKAM across the world for bringing all of us together. It's really fascinating to see how you have been engaging youth volunteers and young people in different locations to bring about changes within the community, within their own community, and across the world in India. Uh, this is really important. The EKAM model is really pertinent and important in current times because talking about holistic well-being is uh, what we see its need increasingly in the current days, because we have seen that the current crisis of COVID-19 has brought about a multifaceted challenge in our society. We are seeing people not just falling sick, but we are seeing also indirect impacts of it. Family members of sick people uh, being stigmatized, or losing their jobs, having to migrate from one place to another without adequate social safety nets. Uh, Access to healthcare being diminished because we are seeing that a lot of public health facilities in the country being devoted to COVID care, and therefore a lot of the poor and marginalized people who access these public facilities for low cost care are not able to do so because they are afraid uh, of contracting COVID at these facilities, and in some cases, the non-COVID essential health services not being available at all in these places. So the challenges are really multifaceted, and we are also seeing a lot of people slipping back into poverty because of increased healthcare costs, loss of job, loss of livelihood, and what I would really like to highlight here, that the challenges are really multifaceted, and the issue of holistic well-being over here is really important. And in this regard, the initiatives that EKAM is undertaking in terms of uh, infusing sustainability initiatives at a very granular community level, whereby young people are taking initiative and finding ways to make their communities more resilient through unilateral action, community level action, or philanthropy. These are really important practices to inculcate in the youth in these days, actually. And I really congratulate EKAM across the world for uh, taking this forward. What I would also like to highlight here is the importance of working at a more systematic level, where uh, community level actions can be made more sustainable, and this can be made more sustainable to uh, do bottom up work towards more policy driven, more sustainable solutions, where the community level initiatives can be sustained over a period of time, and this can be brought to a critical level where they take on pace on their own, not and does not need pushing by one or a collective of organization, and it takes a pace of its own. It's an important area that needs more focus and initiative, and I would urge EKAM to look in that direction as well. And in this regard, actually, EKAM is also helping us. We partnered with EKAM in this regard to do a lot of, to help us in providing community level support in terms of tracking of pregnant women, lactating mothers who are facing difficulties in the current context, to provide that support support system that is missing. But in addition to that, we are also partnering on important technical aspects of work, building, trying towards improving quality of care at the facilities, improving knowledge about guidelines and technical aspects of COVID-adapted programming, if I may say so, COVID-adapted programming in the states, because a lot of our traditional way of working has changed and has to change in this time. So we are all trying to adapt in this regard. And EKAM is doing some important work with us in this area as well. So I'm really happy to see you all. And once again, congratulations to what EKAM and all of you together have achieved so far. Thanks for this opportunity to hear you out and to speak in this forum. Thanks from my side.
Thank you so much. Yes, you've given us a very opportune insight to see what the UNICEF has been doing and seeing what's happening in different countries as of right now. So thank you so much for that, Mr. Ganguly. So now can we have the next speaker be introduced, please?
Yeah. So thank you for all that information and all the hard work and effort you guys have all put in. It's very admirable. Next, I'd like to introduce our next speaker, Mrs. Rajeshri, who is an IT industry veteran and a social impact leader with nearly 30 years of global experience. She obtained her master's degree in electrical engineering from Indian Institute of Technology, Kharagpur. Mrs. Rajeshri is also a Six Sigma Black Belt, which means she's a professional who can explain Six Sigma philosophies and principles, including supporting systems and tools, and she's also a certified executive coach. Currently, she's the Chief Executive Officer for Cognizant Foundation and plays a key role in involving an overarching charter for the foundation, defining CSR strategy and goals, managing operations, communication relationship with a broad set of diverse stakeholders. With that, let's welcome Mrs. Rajeshri to deliver her address.
Thank you, Ananya, for that wonderful introduction. First of all, I would like to congratulate Dr. Sai. Sai, what you started as a seed initiative, with a great vision and a very clear purpose, and of course driven by dedicated efforts. And I'm happy to see that it's gathering momentum with many, many inspiring volunteers joining hands with you now across the globe. And I'm so happy to see the volunteering spirit. Of course, I come from Cognizant family, a company which has leveraged the power of employee volunteering to the maximum to drive a culture of purpose. Just to say that, Cognizant launched our volunteering movement in 2007, and we've clocked about 3.4 million hours of volunteering with 200,000 volunteers. I'm sure that EKAM, US, UK, and Canada put together, you can actually, just surpass those numbers. And I'm happy, with outreach volunteers volunteering from 29 countries in 37 cities, impacting about, I'm sure that I wish EKAM actually take on big in this volunteering journey. Coming back to foundation, it's about 15 years old organizations, and our association with EKAM goes back 11 years. We started our association in 2009. Of course, CF focus a lot for providing quality access to quality healthcare, education, and livelihood opportunities for the underprivileged from remotest parts. And how we do it, we very clearly wanted to have a very clear, sharpened focus. And we work on programs with very clear, defined objectives. And of course, we partner with very, very credible partners who kind of aligns with our values and work for those objectives. And why definitely we want to maximize our impact because resources are always a constraint across the world. But if you put it to use, properly, efficiently, and definitely we can actually maximize the impact. And we want to maximize the impact and the outcome for all the efforts that we put in, and as well as all the efforts that our partners and volunteers like you put in. So that's exactly what we do. And we focus on a couple of areas, healthcare, education, and livelihood. Let me talk about healthcare, particularly for this. We focus on two major areas there. One is preventing avoidable blindness, obviously because India has such a large burden of blindness and vision impairment. Globally, about 39 million estimated globally to be blind, and India has a share of 12 million blind people. And particularly 75% of that is avoidable, which means it's preventable. So that's what actually touched us, and we wanted to focus on that. And with all our programs across 9 states, we've touched about 1.6 million people through our preventable avoidable blindness and vision impairment program. And our another major focus area is women and child health. I mean, we know that the vast majority of maternal and child health that occurs, despite all existing known and affordable treatment for a variety of reasons. One, awareness, accessibility, and so on. So we started with the goal of to improve the access and quality of basic healthcare services of women and children. And we've been supporting a variety of programs through the underserved women and children, particularly focusing on reducing infant mortality, maternal mortality, and as well as infant disability. Here again, it's not just about preventing blindness. We also want to prevent all disability, and particularly earlier the better, because definitely that's going to prevent the disability for the life. And we've benefited we've actually touched about 7 states with about 300,000 people, particularly in this program. And with EKAM, we specifically, Dr. Sai mentioned that the reason why we selected EKAM is that for all our programs, we follow the OECD's ways of looking for relevance, looking for coherence, looking for efficient implementation, effective implementation, and more importantly, sustainable impact. And if you have to actually create that sustainable impact, the community participation is a very, very big thing. And EKAM, I really appreciate, how we kind of try to make the community participate. And some of the programs that we've worked with EKAM, we're focusing on government systems and public healthcare systems. Because that's where you can really maximize your efforts. And some of these programs like RBSK program, that we talk about for preventing disability. The program is started, the policy is good. Mr. Ganguly talked about policy and systemic interventions. The policy is good. It starts with all the good intention. But somehow it's a very last mile, few things are missing and the effectiveness goes down. And that's where I really liked about EKAM, because you go back, work with government systems and exactly identify that small delta that is missing. And just plug that in so that the overall, systemic efficiency kind of goes up. And that's exactly what we look forward for partners like EKAM and Dr. Sai and the team, been doing a wonderful job of working along with government systems and looking for those small gaps. We started with, in 2009, with a very small grant, actually for the variety of things like small equipment to setting up a complete high dependency unit for Institute of Child Health and EGMO and so on. And a lot of equipment for special new carbon units, blah, blah, blah. But then we really like the way in which you have grown. And we are looking forward for this program for starting a new project for District Early Intervention Center. I think the COVID pandemic played some spoil sport there. But nevertheless, you also helped us for the COVID-19 as well. Like in the time of crisis, we have many unsung heroes, the doctors, nurses, and a lot of other workers, healthcare, police officials, and so on. And I think given our focus in healthcare, and particularly with public health systems, a partnership with EKAM, we wanted to actually go and reach out to those institutes. We actually we partnered with several partners across 9 states. So we reached out about 70 plus institutes to providing all that protective gears and small equipments again there, which were missing. All the bigger ones gets noticed, but we realized the smaller ones were always in short. And with EKAM, actually, I think we were able to service for 5 different states across India. And really, thanks a lot, EKAM and team. And I think I have to take this opportunity to wish all the EKAM ambassadors in US, UK, and Canada, and particularly please pass on the wishes to all those young ambassadors. You are really inspiring us to do more. And thanks a lot. And we wish you that, I'm sure that many more volunteers would be lining up for speaking in your next event, and it'll be an entire day of inspiration. Congratulations and best wishes.
Thank you so much, Ms. Rajeshri, for that. Your enthusiasm and your effectiveness is so inspiring for all of us. You've definitely been one of the original supporters of EKAM, as you said, since 2009. We thank you so much from the bottom of our hearts for you to be here today and speak to us. It means a lot. So Ananya, can we please introduce the next speaker?
Yeah. Next, we have Dr. Krishnamurthy, who's a psychiatrist in Apple Valley, California. He attended and graduated from Bangalore Medical College, Rajiv Gandhi University of Health Sciences Medical School in 1971, having over 50 years of diverse experience, especially in psychiatry.
I'm sorry, can I interrupt? I'm so sorry to interrupt.
Oh, yeah.
I just want to say Dr. Krishnamurthy is an allergy specialist, and he's actually located in Colorado. I'm so sorry, Dr. Krishnamurthy, for the mix-up. But he's from Mysore Medical College, Graduate Association of North America, and he's been working with EKAM, as he'll tell us about it himself. Hey, he treats people and he makes them better, right? That's what matters in more ways than one. Here you go, Dr. Krishnamurthy, all for you.
Thank you. Samir, can you start the slides?
I have the slides, yes, thank you.
First of all, I was going to say, EKAM presentation so far has given a very good breakfast for the mind. Because, we are in Colorado, it's still in the breakfast time here around 10:30 or so. And the project that I'm going to share with all of you is about the very good cooperation that we got from EKAM India with MMC Ghana that Neelam has mentioned, which is the Mysore Medical College Alumni Association in North America. And also I wanted to appreciate our 1965 batch. That's when I entered the medical school. So I'm going to share some of that. Is Samir, the slides are ready?
Yes, can you see? Okay, yes, they are.
Yeah, we'll share them right now.
Okay. And while this is being coming up, I wanted to thank Neelam Reddy that she contacted me about a few weeks ago to do a brief presentation. And as I mentioned earlier, this is really a good cooperative effect from the EKAM in a pediatric hospital project in the Mysore Medical College. And I always show this picture. The one that we saw was we all graduated about more than 50 years ago. And then when we had a 50-year anniversary, our graduating class, we went back and we get an idea how we want to help our medical college. As many of you know, most of these medical colleges have really gone down in terms of the facility improvement, equipment, but the patient care has really gone up. This is happening all across India. So because the government is unable to take care of the advancement that's happening in that. So we wanted to help something. So anyway, the class of 1965 batch, MMC Ghana and EKAM, we joined together, refurbish and improve the medical facility in Chalwamba Hospital at the Children's Hospital in Mysore in 2019. So the plans were to improve the existing PICU, step down pediatric ward, pediatric emergency room. So the department identified the areas of improvement necessary for equipment, staff training to accommodate changes in the near future. Next slide, please. Next slide. So you can see this is a common picture that you all see in various parts of India when you go to the big hospitals, especially government hospitals or public hospitals. This is as usual overcrowded. They had, sometimes 3 to 4 children in one bed. It is really, disheartening to see the effect of what is happening in India with the increased population. Can you go to the next slide, please? So this is another picture of the pediatric ward and the existing PICU in the department. Can you go to the next slide, please? So with the information we got with the need assessment, the Children's Hospital requested some of these, fairly high-end equipment. For example, upgrading the 10-bedded hospital, PICU, multi-channel monitors, infusion pumps, syringe pumps, mechanical ventilators, and other equipment. Can you go to the next slide, please? So I've been working on this project for about 4 years. Our 1965 batch classmates in USA, we are about around 40 or so. Finally, I was able to contact about 20 people. And we raised approximately $45,000. And with this, what we do is with MMC Ghana, which is our organization, can match that. So we were able to matching funds. We were able to get that. And also we raised some money both in India and in UK. Actually, I see some UK friends here. I have a couple of good friends in UK also, and they also gave the funds. So this is the things that was done. And the EKAM's role was reviewed the equipment list, visited the Children's Hospital, India, did need assessment evaluation, and obtained a competitive bid and chose the vendors and obtained a 5-year service warranty. And I think I just wanted to emphasize this in anybody doing work in India is to really get enough warranty services to these equipments so that it doesn't fall apart after 1 year or so. And we also, they made the EKAM was helpful in installing all the equipment and staff training, monitoring and utilizations periodically. Next slide, please. So this is actually the final version of the equipment that we did. I won't go into the details. We have, the main thing was actually the respirators, 2 ventilators that we got the high end and at a cost of about $64,000. And we had about another 20 lakhs of work done in India when we collected the funds there, improving the pediatric wards. Can you go to the next slide, please? So these are the kind of equipment that was gone, some syringe pumps here in this picture. Can you go to the next slide, please? And you can see the staff training was done by the vendors, technical people. And they went there and spent a couple of days there and trained. And only one good thing I was going to say is we got everything done just before the COVID actually. And you can see they're wearing the mask by the time they started installing the equipment. The COVID has just started. So then we got some utility information after that. It was very helpful. And so I just wanted to thank all of you at the EKAM. And also special thanks to MMC Ghana and a big namaste to EKAM and also EKAM USA. And I just wanted to say what I saw was at the EKAM today's program, when you see the youth involvement in US or in other over the globe, the sustainability of EKAM will be for permanent. I'm very confident when you see the youth involvement, we have sustainability of the program itself, which is the EKAM. And I wanted to thank Sai Lakshmi. I spoke to her a few times. And she's a blessed person that all of you know that, but she has done a phenomenal job in maternal and child health care. Thank you very much.
Thank you, Dr. Krishnamurthy. Yeah, definitely. It was so inspiring to see the things that you did in Ghana and how EKAM and how you explained how EKAM was also part of that. So I'd really like to thank you. Our next speaker is Dr. S. Elirasi, and Dr. Elirasi is a pediatrician in Saligramam, Chennai, and has experience of 28 years in this field. Dr. S. Elirasi practiced at the Mayura Clinic in Saligramam, Chennai. She completed her MBBS from Kilpauk Medical College in Chennai in 1985 and has a diploma in child health from Vardhaman Mahavir Medical College and Sarfang Hospital in Delhi in 1989, as well as she's an MD in pediatrics from the Stanley Medical College and Hospital in Chennai. Let us now welcome Dr. Elirasi to deliver her address.
A very good morning, afternoon, and evening, as the case may be. And it's really a proud moment to be part of this elite and august gathering. And it is just to see that the whole world is geared up to help EKAM, to help the children and mothers across the world. It is really heartwarming. And my association with EKAM is that, like, first when I was a junior assistant, once I have to go to a Balwadi to screen the children for illness or any vitamin deficiencies. I was wondering who was actually asked for this system. Then I went, we referred some children back to a hospital. Ours is a 837 bedded exclusive children hospital, the biggest in Southeast Asia. So we referred all these children to our hospital, and we kind of evaluated and treated them. And it is when they just looked up like who has started this project and all that in 2009. And I found it was Sai, who was just somebody, to become my close friend and a great person today, and see that she has grown in all throughout the globe. And, she's really standing as an example. Proud of you, Sai, and grateful all the good hearts for helping. Actually, the concentration of the concept of EKAM was to target the mother and children. It is true, because if you take the population of ours in India, 1.38 billion, almost 70% is only mothers and children. Unless you target them, you cannot have a sustainable growth in the country. And what happens is only a healthy mother can give to a healthy newborn and a healthy child, healthy adolescent. Though maternal child health care has been there in the Indian system as early as 1921 and again reinstalled by the National Health Mission in 2013 as reproductive child health care with newborn child and adolescent, you realize that it's a cycle. A healthy mother, healthy child, healthy adolescent, again the cycle goes on to become another mother who can give rise to a healthy nation. So this is where the EKAM has intervened. And though we have a very good health system in Tamil Nadu in 32 districts, and very proud to say the highest number of SNCUs, that is a sick neonatal intensive care is in Tamil Nadu, but still to refer them here, to identify them, give good food to the poor, all that was taken by EKAM. So the vision of Sai was that she picks them and she works with the government, with the private hospitals, with the government hospitals. So where there is a small lacuna, she tries to fill it. So like, for example, like suddenly we think we want to buy 2 more ventilators for the PICO and we plan. In the meantime, she'll try to give us ventilators for rent so that she'll cover the rent and we manage that before we get the ventilator. So she was trying to build in. So all the poor, and Tamil Nadu does not cater only to Tamil Nadu. You should know that most of the Andhra Pradesh in Kadapa, Nellore, they don't have a free health system. Whereas here it is, everything is free. In Tamil Nadu, government is 100% free. We even give food for most of the mothers who are staying with children. So most of these patients come. So our health requirement, health need is very high. Even today, you know, in COVID pandemic, the Tamil Nadu government is giving free food to the patients and the doctors and nurses on duty. Literally, crores of rupees are flowing for the healthcare. So in spite of all this, you realize that we also need some help. So it is when that a person with a dedication like EKAM comes into view. They give us small things, what we ask, we don't ask. Also, they donate things. We can concentrate on bigger things. See, for example, in this COVID pandemic, we got lots of caps and gloves because every time we have to discard the gloves examining a patient. We don't use so many gloves. So now we have to wear caps, we have masks. So all this voluntarily, if somebody comes and donates you, it helps in the patient care. So this is how she has been helping us. Her idea is that every mother and every child should get the maximum health care. And that is the aim of all of us. So the idea of EKAM when we started, and now I realize the EKAM Foundation and 20 things in US, they are able to get so many youngsters involved, collecting money, feeding people in the COVID. It is just astonishing to see that they're not only helping India, they're also helping their own colleagues who need food, and it is absolutely fantastic. So not only to say that, I think, see, I keep talking about receiving and getting things from EKAM, but I think it's our duty also to promote donation. So what in my, see, I also in charge of the pulmonology. So when I discharge a patient on home oxygen, say, or a child with interstitial lung disease, then the child will require a home oxygen. So see, this machine will require a monthly rent. See, we will give all treatment free and send them home, but that machinery may require rent for a month. So when EKAM will come in to help us by giving oxygen concentrator for home or bearing the rent. So we kind of collect donations from all of us to try to give it to EKAM, because indirectly it is helping us, helping the children, helping everyone. And not only that, she also follow up, and also when we discharge the sick into some village, newborn who is sick and improved and gone, they have an access even to the remote village, and EKAM is available in one phone call. So they kind of help even these children. So this is the kind of service that I have been mainly a recipient, I would say, like sitting in such a big hospital, and I have been mainly a recipient of all good things, but it is my duty also to give back. So I also keep promoting everybody, telling, keep supporting EKAM. They not only serve us, but they serve everybody across, not only Tamil Nadu, all the 32 districts, but throughout India. Now I see that they are globally to Canada, UK, and USA, everywhere. And so I just congratulate Sai for what she thought was just a mother and child health care, and now she's really gone. She's supplying nurses train nurses to our NICU, giving even training for doctors. And it is her idea is expanding. She's growing like a banyan tree. Let her growth continue. And all of you, I'm just amazed at all your volunteers. I thank one and all of you, and let the good service continue. Let all of us grow together and build a strong community with a good health, not only for the mother and child, but for the whole nation. Thank you so much for this wonderful opportunity.
Thank you, Doctor. Your encouragement is so inspiring for all of us to really just push through all the things that we have, and really encourages us to volunteer more and be more involved in EKAM. And thank you for all those examples. So now, Shreya, could you introduce our next speaker?
Dr. Satya Jagannathan is a pediatrician in Chengalpattu Government Medical College in India. She led the creation of a low-cost baby warmer made out of readily available 100-watt light bulbs and locally harvested wood as a solution for cutting the mortality rate of neonates at her rural hospital. Costing only $100 to build a fraction of the cost of commercial alternatives and easy to maintain, the warmer soon reduced the hospital's infant mortality by nearly half. Technical and business development help from LRAMP India is allowing Dr. Jagannathan to further develop the product design and create a business model. This key supports she'll soon be able to distribute the infant warmer to other rural hospitals in the region. Now let's welcome Dr. Jagannathan as she joins us.
Good morning. Am I audible?
Yeah, please go ahead.
I thank EKAM USA for inviting me to the webinar. And it's a pleasure for me to be associated with EKAM. And I'm a good friend of Sai. And for the past 15 years, I'm associated with Sai, and we have been getting help from them. And EKAM is one of the NGO through a private-public partnership. It has been helping the rural children for a long time.
So we can't hear you. Can you unmute?
Dr. Satya, can you unmute yourself?
Yeah, we can't really hear you. Are you able to hear us? Sorry, just some Wi-Fi difficulties here.
So there's some net issues.
Yes.
We're good now if you want to continue.
EKAM, and through the private-public partnership, many nurses were recruited into the system, and they were trained into the newborn care. And across the district, about 74 districts, 74 SNCUs were started throughout all the districts in Tamil Nadu. And not only that, these nurses were mentored by the EKAM for nearly 5 to 6 years. Then after that, gradually they entered into the government system to a regular medical recruitment board. And all of you know that equipments are very important for newborn care. And it was, we found it was at least sometime easier to get equipments, but it was very difficult to maintain them, especially in the remote rural areas, because many a time they become repaired and they're lying waste for a long time. And EKAM, they devised an idea of recruiting engineers for all the districts, and they were doing preventive maintenance, and also they were teaching our nurses how to maintain these equipments. By the efforts of EKAM over a decade, the neonatal mortality in the state declined from nearly 21 per thousand live births to 16 per thousand live births. And the same model was gradually being replicated into other places. And not only that, EKAM supporting equipment and whenever there is a need, we ask them and immediately it's given. Government of Tamil Nadu it collaborates with various NGOs, and from the receiver point of view, what is fine, like whenever we give a request to an NGO, it's a very long process because it has to be approved by many directors of both. But when we tell EKAM and they understand the emergency, and then they try to help us very early. For example, now during the COVID times, we developed a new COVID ward, 250 bedded ward in the mother and child block. It's a newly built building, but we needed emergency oxygen connection from the main manifold room to the building. And we were trying to get funds, and then we told EKAM that we need it immediately. Otherwise, all this rush of patients cannot be accepted. And without any thought, so I said, okay, madam, we can go ahead with the project and somehow we can manage the funds. And because EKAM asked for the work, and many oxygen pipeline dealers, they came without even getting any advance and they started working on the project. And it was completed within 2 days' time, and we could move 250 patients into the COVID ward within a short time. So whenever there is a need, we ask EKAM and then they help. And I'm so happy to see that so many people are helping EKAM throughout the world. And I'm very thankful to you. And from the children and the mothers of Tamil Nadu, we thank you from the bottom of our heart. And I hope all of us can work together with EKAM to help the mother and children. Thank you.
Thank you so much, Doctor. Yes, and your inventions are truly inspiring for all of us to really work harder and more.